I wasn't expected to live. When I was diagnosed with sickle cell at the age of 4, we were told that and this without any care, they were speaking over me on the bed. So it's something that stuck with me. That 14 to 21 years at most. So growing up, I really didn't expect that I would be a mother, much less a grandmother. I wasn't expected to live, but things have changed now. They stopped giving us out these sell-by dates, these expiry dates, and they're working now to give us life. So I'm appreciative of that. So yes, I am a grandmother and a mother. I'm also, as Carol mentioned, an initiate of Kemetic philosophy and spirituality. I graduated in 2023, and that's the reason why I am now known as Karsheta. The name I was given from my parents is Samantha, but Karsheta is my spiritual name. I'm a community volunteer since 1997, and I'm the co-founder of Healthy Living International. I'm a founding member of the Gift Genius African Heritage Wealth Empowerment Program. I'm the founder of Sickle Cell Cause, and of course, yes, I am a sickle cell warrior. We call ourselves warriors because from waking up till going to bed, it is a fight, it's a struggle. So life is a struggle. So that's why you will find that sickle cell patients are known as sickle cell warriors. So I'm not a medical professional. So what you're learning today is from lived experience and through my advocacy work. Okay, so today I'm going to be speaking out. It is the 1st of October. So it is September is World Sickle Cell Awareness Month. And now we've come into October, which obviously is Black History Month. So combined into two. So today I'm going to be speaking about the history of European and UK sickle cell support and research, how it came about, how the support system within the sickle cell arena came about in the UK and Europe. Right, so it is the 10th year memorial where we are honouring Dr. Neville Roy Clare, and he was the founder of OSCAR. OSCAR was the first sickle cell research and support organisation in the UK and Europe. This is Neville here, and he was a sickle cell warrior. Sadly, he passed away in 2015, 10 years ago, and it was actually I was a mentee of his, from childhood, and it was him pushing me to set up Sickle Cell Cause. The last 6 months of his life was like encouraging me, on how to do things, what stuff to ignore, the politics to ignore, and to use the strengths that I have, with creating and founding this organization. So I stand on the shoulders of Neville Roy Clare, as does every sickle cell support organization in the UK and Europe, because it's from his blueprint or black print that all of these organizations have come to pass. So this is some information about Neville. I've got some things here that I've written. Right, so Neville was a pioneering advocate, academic and researcher in the field of sickle cell anemia. He was born in Jamaica, and Neville was finally diagnosed with sickle cell in the UK when he came over, in 1967. Before this, his parents didn't know the cause of his frequent attacks and debilitating hospitalizations. Finally, frustrated by the lack of knowledge surrounding his condition, he founded the Organization of Sickle Cell Anemia Research in 1973. This was the first voluntary organization dedicated to the sickle cell advocacy and research in the UK and Europe, initially operating from a small shed office in Wood Green, North London. OSCAR soon became the first charity dedicated to the support and advancements of the well-being of sickle cell affected, and was officially registered as a charity in 1975. This document on the right is the introductory of OSCAR way back in 1975. Throughout the 1970s and 80s, OSCAR expanded beyond London, establishing branches in Birmingham, Reading, Leicester, Nottingham, Bristol, Sandwell, Croydon. His tireless efforts were instrumental in creating a strong support network for individuals living with sickle cell disorders. In the early 1980s, Neville co-founded the Haringey Sickle Cell Support Group alongside Susan Treasure, one of our nurses. Their collaboration provided much needed support and advocacy for individuals living with this debilitating disorder. Now, Neville's Oscar was more about research, because at this time there was nothing known about sickle cell in the UK. So Oscar started off being a research organization and supporting other people such as himself with sickle cell, but it was mainly research. After such, when more people started coming forward with the sickle cell condition, then with the help of nurse Susan Treasure, they set up Haringey Sickle Cell Support Group, which was more for the actual patients, more support, dealing with the actual day-to-day living with sickle cell. Okay, so their efforts culminated in the establishment of the George Marsh Sickle Cell and Thalassemia Centre, which is in St Anne's Hospital, still standing today. Now, it's called the George Marsh Centre because, actually, I'll tell you a bit about that in a second. Right, so Dr. Clare Neville's academic achievements further bolstered his advocacy, and he earned a PhD in health education and used his lived experience to educate healthcare professionals and the public about sickle cell anemia. His work emphasized the importance of proper medical care, social support, and a better understanding of the condition. Before this, it was unheard of for the patient to be advising the medical professional. In his later years, Dr. Clare founded Sickle Watch, which was an extension of Oscar, and he mentored many sickle cell warriors to become advocates, and myself is amongst that number. So that's a little bit about Neville Clare. And if you want some more information, you can look in Staunch magazine in the Black Cultural Archives. Okay, moving on. So this is a picture when Neville was doing, his research way back when he founded Oscar, and he used to travel to like America, Jamaica, Africa, putting, the research together. And I always use this picture because lots of people have heard of the Sickle Cell Society that is still running today. So at the back here, you will see Neville, and this is his family. And he also worked with a student nurse at the time. Her name is Elizabeth. She's at the front here. And she later went on to found the Sickle Cell Society. So her first education into sickle cell and the sickle cell arena, the support arena, came from the works of Neville and Oscar. Okay. So just to tidy up that brief history, in 1973-74, Neville Clare founded the Organization of Sickle Cell Anemia, Oscar, first organization in the UK and Europe. It was officially registered in 1975. In 1981, Susan joined Neville, where they created the more community-based Haringey Sickle Cell Support Group, which was first operational from offices in Wood Green, rented offices. Now, we was having a meeting there one time, and we used to have to wait for the person with the keys to come and open the door, to let us in, because the offices was used when the building was closed. It was in the evenings after work, and we used to use their space. No, we didn't have a space of our own, and one time the person with the keys was running late, so we was outside huddled underneath umbrellas. There was about 15, 20 of us, waiting for the key holder to come to open the door. And who should drive past but our consultant, Dr. George Marsh. And he saw a bunch of his sickle cell patients standing out in the rain. Obviously he's concerned because this can cause a sickle cell crisis. So he asked what was we doing there. He stopped the car, leaned out, asked and we explained that we was going to have a meeting. At this time, it was very rare. He didn't know anything about these. So he joined us for that meeting. And it was from that meeting that he said that he was going to join us and advocate for us because we needed a building for ourselves. So it was like the works of Neville, and then Dr. George Marsh seeing that work that brought about the George Marsh Centre coming to fruition, right? But Nurse Susan Treasure worked with Neville for a number of years, many years, and sadly she was a ward nurse, so she was on the wards with the sickle cell patients. And in her retirement, she then founded Enfield Sickle Cell Support Group, which is in the town next to Haringey. Sadly she passed away in 2011, and I was asked to join their committee to help revamp the group in 2012 because when she passed, the numbers were dwindling and people weren't getting the support they needed. So I did that until 2014. And then it was then that Neville advised me to set up Sickle Cell Cause. Okay, so this is Dr. George Marsh. So in 1985, he promised campaigns and fundraised with his colleagues and MPs, for a purpose-built hub for the sickle cell and thalassemia patients. And this was to be used for, medically equipped drop-in center for recreation, resources, and public information. So it was an open center, and it was the first of its kind, the first purpose-built center for sickle cell and thalassemia patients. Sadly, Dr. Marsh passed away in 1987. The building was completed in 1988. So sadly, Dr. George Marsh didn't see the building in operation. This is the building. So sadly, he didn't see it. So whereas it was going to be called the Sickle Cell and Thalassemia Centre or something along that lines, it was then named in honor of Dr. George Marsh. So that's the reason why it's called the George Marsh Centre, in honor of his works and him galvanizing, the professionals, to get the centre built. It still stands today, and this is where I work from, the George Marsh Sickle Cell Centre. Right, so 1989 historically recognizes the first purpose-built, community-based, medically assisted sickle cell and thalassemia centre in the UK and Europe. It's the only one still standing. Over the years, they keep taking it from the sickle cell community, and we have to fight to get it back. So it's always in question whether we're going to be able to continue to stay there. But sickle cell is rising. And we just always ask people, our community to stand by us, with helping us to keep our centre. Other buildings have been opened and then closed, but this is the first one and the only one still remaining in operation for purpose. And you can find reference to what I've just said. Other warriors, their memories. It's not just my memory, but you can ask other sickle cell warriors. Then you have an Oscar for My Troubles, the autobiography written by Dr. Neville Clare. I've also found information in the Enfield Independent, January 2010. You can look online. Tottenham and Wood Green Journal from 1989. The information there. And the Nursing Times, the 8th of February, 1989. I'm sure of people that do research, such as yourselves, if you want more detailed information, you can find it, how the George Marsh Centre came about. And if you do find some details, please can you share it with me? Because we really, although we have our memories, trying to find the paperwork to go with it seems to be proving very difficult. When we're gone, where will the memories be? So if you find anything, please share it. That's all I ask. Okay, so Dr. George Marsh, Susan Treasure, pioneers of UK sickle cell support and research, and also the founding member, Dr. Neville Clare. At Sickle Cell Cause, every second Monday of the month, we have a book club, and we're currently reading An Oscar for My Troubles, which is, as I said before, his autobiography. Remember, he's a member of the Windrush generation, so you get personal facts about when he came over, what he went through, what his family went through, him, going to college, university, finding a job. It's very funny. It's very passionate, but there's so much funny things in there. Right, he's the first researcher of sickle cell, as I mentioned before, and he benefited not only the patients, but the medical professionals, and he deserves his flowers. He's an unsung hero. Through his works, he also founded Sickle Watch, as I said, but he also encouraged me to set up Sickle Cell Cause, and that was founded in 2015. So not only is 2025 10 years memorial year of Dr. Neville Roy Clare, it's also 10 years highlighting Sickle Cell Cause. Moving on. So what do we do in Sickle Cell Cause? Right, we're a peer-to-peer patient support network, and we work with parents of sickle cell patients, schools, churches, the medical professionals, but mainly, fundamentally, we're advocacy and peer-to-peer support. And some of our support services is talking therapy, because there's a lot of things that people need to let out, shared patient and caregivers talents and services. Most of our services are provided by our supporters and sickle cell warriors themselves. Right. Our services include, with our social support network, is benefit support advice, housing advice, because there's criteria with which a sickle cell patient, needs to be living by. I can go into that another day. Don't want to take up my time with going into detail about all the different aspects of issues that living with sickle cell causes. Appeal court support, because when somebody goes for their benefits, usually we're refused first and then we have to appeal it and then they get it. So we have to accompany our peers to the appeals court. We do a personal home care and hospital service where we visit our peers, help them when they come out of hospital, whether that means tidying up, going to the shops, doing some cooking, also hospital visits, and that could be in A&E when they're going through the rigmarole of trying to get a bed, or dealing with the hospital staff that don't understand what sickle cell is. There's a whole plethora of things that we have to do with supporting one another. Our services also include counselling, bereavement. So many of us die in sickle cell. So there's the trauma that comes with it, trauma, anxiety. We do meditation and family therapy. Our activities include kinetic yoga, massage therapy, hand and feet, massages and nail care, and also social excursions. We have a book club. There's many things. We do youth upliftment, career planning and business building. I said the book club. We have volunteers workshop, sound therapy. There's a list of things that we do. But the main thing we say to each other as sickle cell warriors is to remember self-care and personal responsibility. We cannot allow others to be fully responsible for ourselves. We have to take our health into our own hands, and don't be reliant on others. So one of the things we advocate for is holistic therapy, right? And say, like, our diet, eat real food, try to stay away from the processed foods because they clog our blood cells. Drink clean water. When I say clean water, I mean filtered water, not just drink from the tap or certain bottled waters. Meditation is important to clear the mind, because there's a lot of trauma going on. Massage therapy to help loosen the joints, help the muscles. Herbal supplements, so you try not to be so reliant on so many prescription medications. Get your 8 hours or as much sleep as you need. Yoga, counseling, peer-to-peer bonding, healthy reading, So the pictures here at the bottom, all of this is raw food. All of these little dishes there, like there's mushroom dishes, there's all of those are derived from raw food. And this book on the right is written by a sickle cell warrior. Her name is Frida Gacy. She works with us, and she also writes up our diet plans, when we ask her nicely, like on an individual level. But she's a raw food dietitian, and you can get her book. There's lots of recipes in there. Always mention her book, on Amazon. Create Your Health Naturally by Frida Gacy. She hasn't had a crisis in over 10 years. So she's somebody that is very instrumental with supporting us and helping us with our growth when it comes to diet and nutrition. We also say be active, stretch, massage therapy, yoga, healthy reading, it's all important for anybody, especially for the sickle cell warrior. So these are some of the services and things that we do within our organization, which I just mentioned. So those are just flyers that you will see around the community. Okay, we also do advocacy. We're very strong on advocacy. We have 4 advocacy campaigns running at the moment. I'll just mention 2. One of them is what we call Halt to the MA and PhD Ego, educate the professionals, because too many sickle cell warriors and their families and caregivers, approach us with a report of the experiences they have from the medical professionals, and which causes additional physical, emotional, and mental harm when they seek care. Right, Sickle Cell Cause is a peer-to-peer action and support network, right? And every report to us matters. And we go through this through our family welfare department. We listen carefully to each other to understand the full depth of the distress. We analyze the details, the how, why, where, and by whom harm was caused. We provide immediate support by referring our warriors to our professional counselling services for cognitive harm and repair. And then we address the systemic issue via written advocacy, signposting to other agencies, and direct engagement with relevant institutions, right? So we say that it is very important to educate medical professionals. So even though Neville started this, right, it is still very difficult for the sickle cell patient to be heard, because a doctor, nurse, GP, anybody that goes to medical school is not guaranteed that they have any kind of sickle cell awareness in their medical training. So they leave and they become a qualified medic without knowing what sickle cell is. And many times, the first time they see sickle cell is when they're faced with a sickle cell patient in full-blown crisis. It's happened to me many times, and it's not a pleasant experience. And when you're trying to explain what's the matter with you and what drugs you're accustomed to using, you can be looked upon as a drug addict, because we're mentioning very strong medications, and we're not heard because we're the patient, So we say that mandatory education, what is sickle cell and how it manifests in a patient, for all practicing and newly qualified professionals, and its inclusion of sickle cell awareness as a core component of every medical curriculum. That is what we're campaigning for. We also have the Meet the Warriors, where our signature program brings sickle cell warriors and their supporters directly to the medical professionals in a respectful, interactive sessions where warriors share personal experience of daily life with sickle cell. They talk about the medication and the routines, the environmental triggers, and the realities of a crisis. We have open discussions and Q&A, and these conversations reveal the individual nature of the condition, because every sickle cell patient is different. Also the life-altering day-to-day challenges faced, by living with, by a patient. It's our life is in the balance, and sickle cell crisis is an actual emergency, a life emergency. So that's one of our advocacy, Halt to the MH and PhD egos. The other one, which I'll speak about more detail later on, is where we ask you to recognize sickle cell anemia as the primary cause on death certificates. So in brief, while you're reading that, I'll just explain that I'm a sickle cell warrior. I live with sickle cell. But when I die, I'm going to die of something like either a stroke or a heart attack, a brain aneurysm, pneumonia, any number of things. And that is what's going to be written on my death certificate when I die. Right. But there's no reference to sickle cell. What we're campaigning for is that on our death certificates, yes, I did die of pneumonia caused by sickle cell anemia, because while sickle cell is not being mentioned on our death certificates, this is what's keeping our research numbers low, and this is what's keeping, we bring the numbers up for like, oh, she died of stroke. All right, the stroke society's got another, or died of pneumonia, that goes to the pneumonia. So they're getting, our deaths are advocating for their for these health conditions, but it's not advocating for our own. And that is why we're always fighting, to be recognized, to be seen, because we need sickle cell to be recognized for what it is. It causes deaths. It caused the heart attack. It caused the stroke. It caused the pneumonia. So I will be sharing the QR code a bit later on, asking you if you can please sign our petition to have sickle cell registered on our death certificates as the primary cause of death with the sickle cell patient. Okay, moving on. I'm sure now you want to know what is sickle cell from my point of view. Okay, sorry about that. So what is sickle cell? Well, sickle cell, medically, they will call it a disease, right? But under sickle cell disease, you have many types of sickle cell, right? But if a medical person was referring to sickle cell, they'll say, oh, sickle cell disease. We like to say condition because you cannot catch sickle cell from me by holding my hand, from kissing me or anything like that. You wouldn't catch it. So saying disease doesn't sound comfortable to us, but medically it's called sickle cell disease. And under disease, you have sickle cell anemia and other types of sickle cell. So although the umbrella is sickle cell disease, you also have a type of sickle cell called sickle cell disease and one called sickle cell anemia, which I'll go into a bit later. But sickle cell is an anemia. And there are many types of anemias out there, right? The most common is like general anemia, thalassemia, leukemia, hypoglycemia, and the most common and fastest growing worldwide is sickle cell anemia. And not everybody knows this. People will know more about leukemia. They'll hear more about general anemia, even hypoglycemia. But not everybody's heard of sickle cell anemia. And sickle cell anemia is the fastest growing blood disorder and genetic disorder worldwide. That is why it's important for our deaths to be recognized. The numbers are not matching, right? So sickle cell anemia is a serious, inherited, excruciatingly painful blood disorder of many recorded variations, with 6 in number being the most prevalent in the West, like the UK. And sickle cell is known to affect mainly people of African, Caribbean, Eastern Mediterranean, Asian origin, although it affects anybody and everybody. And 2 of those 6 of these recorded types affect mainly people of African origin in the UK, and that is HBSS disease, which will be referred to sickle cell anemia, and then there's HBSC, which they call sickle cell disease. So as I said, under the umbrella of sickle cell disease, there's many types, and there's HBSS, sickle cell anemia, and HBSC, which they also call sickle cell disease, that there's also others. Now, what is the issue? The issue is the red blood cells, which carry oxygen around the body, develop abnormally, causing the extreme deprivation of iron fluorine, which causes over 20 other diseases and conditions to manifest in a single individual. So basically, if somebody says to you that they've got sickle cell, they don't just live with episodes of pain now and then. They have problems, issues, because everywhere around the body we have blood. So everywhere around the body there's blockages, and it can affect us anywhere and everywhere. So that's the kidneys, the lungs, the brain, the joints, the spine, so everywhere. So, and every individual will have different issues, right? So I have issues with my eyes and my ears, my brain and my joints. Somebody else will have other issues with different parts of their bodies, their kidneys, their liver, their spleen. So it's a multi-organ disorder affecting every part of the body, right? In the UK, sickle cell disorders are more prevalent, as I said, with people of African Caribbean descent. However, sickle cell has nothing to do with the content of melanin in the skin. It's a blood disorder, so it can affect anybody. In other countries, sickle cell is prevalent as well, but in other countries, you might have blonde and blue-eyed people. So it's prevalent in blonde and blue-eyed people, but in the UK, it's more prevalent in the African Caribbean, people. So how is sickle cell passed on? If you only inherit the gene from one parent, you have what's known as sickle cell trait. It's likely that your blood will contain some sickled cells, but you will be able to produce some normal hemoglobin as well, and you won't usually experience severe symptoms. However, you are a carrier of sickle cell anemia, and you may pass the abnormal gene on to your children. When both parents are trait carriers, there is a 1 in 4 chance in each pregnancy that the child will be born with the full sickle cell condition. So every pregnancy carries the 1 in 4 chance. So if you have 4 children, it doesn't mean that only one of those children will get it. It's like 1 in 4 in every pregnancy. You may have 4 children and all 4 have them, or one may have them, or you can see the diagram here. In this diagram, the 2 parents are the trait. One doesn't have it, not a carrier at all. 2 are carriers and 1 has the full blown. So it's a 1 in 4 chance in every pregnancy. So the average lifespan of the red blood cell lives for 120 days, right? So this is the issue. However, with the abnormal sickle cells, there's a shorter lifespan, which aren't, produced and replaced as quickly. So on average, the lifespan of a sickle cell is just 20 days. So there's 100 days difference with the average human being. Normal red blood cells are flexible and disc-shaped. Excuse me. But in the sickle cell anemia, they can become rigid and abnormally shaped like that. And they get stuck in your joints, causing many issues, and they're shaped like a crescent moon or a farm tool, which is called a sickle. So this is the sickle, hence the name sickle cell. The abnormal cells are devoid of oxygen, and they are unable to move around as easily as normal shaped cells, which block the blood vessels. And this results in like tissue and organ damage, daily pain, lethargy, episodes of pain, which is known as a sickle cell crisis. And a sickle cell crisis can last from just a few minutes to several months at a time. Although on average, most people in crisis, it will last around about 5 to 14 days. So I have some histories and facts, and I put a question mark. Where did sickle cell originate? I always put the question mark because nothing is it's what we believe, and it's all out there. But what do you believe? That's all I have to say. What do you believe? Right. So sickle cell has been known for many centuries, and in June 2010, a report was updated. Right, whereas it is now believed by a team of German scientists from the Bernard Nock Institute for Tropical Medicine in Hamburg that Pharaoh Tutankhamun was a sickle cell warrior, and at 19 years of age, he died at around 1324 BC after ruling for just 9 years as a result of living with sickle cell anemia. So this new report states, so this is an updated report from 2010, and I quote, "We question the reliability of the genetic data presented in the previous study, which states Tutankhamun died from a bone disorder or was murdered, and therefore the validity of the author's conclusions." So previously, it was thought that Tutankhamun died from a bone disorder, but they looked again in 2010, and what they're saying now, his radiological signs are compatible with the osteopathological lesions seen in sickle cell disease, a hematological disorder that occurs at gene level carrier rates of 9% to 22% of the inhabitants of Egyptian cases. So with their updated research, it is now believed that Tutankhamun died from sickle cell and not a bone, disorder, which gives credence to how long ago or how old sickle cell is. It's not a new disease or new condition, right? There is also a theory that sickle cell was spread into human beings by a certain type of mosquito, the female of the Anopheles mosquito, which transfers malaria into the bloodstream when they attach themselves to suck the blood in order to obtain the proteins, from the human blood plasma, which they use to lay their eggs, right? So these mosquitoes, survived in shallow waters, in extremely high temperatures, and were not originally close to where environments where humans dwelled until centuries ago in areas like north of the Sahara, where they started to cultivate yams en masse. So it's like forests had to be leveled causing large areas of swamp-like environments. And the rotting trees and plants in these shallow waters caused an increase to the population of these mosquitoes, and the farming population who grew these yams were the first to be affected. So this is what is believed. I tend to believe that, but as I said, I'm not a professional and I'm not a professional researcher, but I've done my research. But what do you think? You know, we've had many different explanations, but what is your theory? Have you ever given it a thought? I'll ask you, please, when you have time, look into it. But now I have some information and statistics without a question mark. All right, so sickle cell was first recorded medically by Dr. James Herrick, a dentist in Chicago, in 1910. So that is when it was first recorded in medical books in 1910. So we have Tutankhamun may have had it, and now in 1910 it was first, recorded in medical books. UK statistics state that approximately 1 in 79 babies are born in the UK carrying the sickle cell trait, and that around 17,500 people in the UK is recorded to have the full-blown sickle cell disorder. They also state that almost 300 babies are born in the UK with a sickle cell disorder every year. Every year, 300 children are born with sickle cell in the UK. The sickle cell conditions are the fastest growing genetic and also blood disorder worldwide. The average life expectancy, up until very recently, it was 47 years. When I was diagnosed at 4 years old in the 1960s, they said 14 to 21. I've had friends that were told 5 years, 7 years, different. But now the average life expectancy, 47 years, but it has increased because some health officials now state 67 years due to the improvements in the management of infections and other complications during childhood. So all the testing that they done on us during the 60s and 70s without our parents' permission has been of some benefit because now we're living longer. Right. So let me just speak about some symptoms and results of these symptoms from childhood. You may notice a yellow tinge to the skin or slurred speech. I know today I've got a bit of slurred speech because I'm tired, constant headaches, could be fainting and blacking out, insomnia, and also hypersomnia, difficulty sleeping and or waking up. And then there's also sleep apnea, right? And delayed breathing during the sleep. That's what that is. Tiredness, complete lack of energy, numbness to the limbs, severe painful swelling of the joints, chest pains, anxiety attacks. Then there's epistaxis, uncontrollable nosebleeds for no purpose, no reason. Unquenchable thirst, furrowing of the tongue, nocturnal and daytime enuresis, they say that happens like you can't control your bladder, and they say that the average sickle cell patient has a smaller bladder. Don't know how true that is, but I've heard that. And then you're encouraged to drink a lot. So there's, many accidents, especially in schools, children wetting themselves. And then in the night, you're dreaming you're in the toilet and, and this can go on into young adulthood, the wetting of the bed. Very common in sickle cell. Then there's breathlessness, consistently cold. Then there's priapism, and that's the painful swelling of the penis, and that can last from hours to weeks, and it can cause impotency, and it is very painful, and it's horrible to see a sickle cell warrior in that pain, with that. Right, so these symptoms, and sometimes including their conventional treatments, often manifest into ailments such as jaundice, iron overload, migraines, gallstones, breathing difficulties, swollen and removal of the spleen, reduced bone density, delayed growth, chest infections, leg and stomach ulcers, blindness, pneumonia, weakened immune system, cartilage degeneration. So you find that a lot of sickle cell warriors have joint replacements, strokes, and there's a lot in childhood strokes and adulthood, but a lot of strokes go undetected, organ failure, and then there's slow or even sudden death. That's what we live with on a daily. So the average sickle cell patient lives with full body pain, bouts of life-threatening sickle cell crisis, eating disorders, prescription drug dependency. Notice I say dependency and not addiction. right? There's a dependency on the drugs because that's the only thing that we have that's prescribed. And these drugs, cause, you're dependent on them. There's nothing else. There's nothing there, which is a story for another day, a subject for another time. Right, then there's trauma anxiety, memory failure, tooth and hair loss, leg and stomach ulcers, as I mentioned before, swollen joints, migraine, hearing and vision impairment and loss, depression, and has a morbid fear of impending death. That is the average adult sickle cell patient. So when you meet the average adult sickle cell patient, the average sickle cell patient has all of these going on. So it's not a case of just bouts of pain. And most UK patients are reliant on the NHS for their treatment. So they're totally dependent on their conventional medications, their treatments, which is antibiotics daily and pain relieving medications daily. So antibiotics like penicillin, if you're allergic to penicillin, then it's like erythromycin or some other antibiotic. And that's because we're susceptible to infection. We wake up in pain. So the first thing we're going to be drawing for is pain relieving medications. And it's not paracetamol. It's not that type of pain. We're talking about morphine, diamorphine, tramadol. We're talking about strong medications, that have a street value that gives us a stigma. Then there's vaccinations, and these are also to prevent infections. And you may have those monthly, annually, or whenever required. And apart from pain medications, the only other treatment is blood transfusions. And they usually give those monthly or whenever required to those that receive them. Right. Then there's hydroxyurea. So when taken daily, hydroxyurea reduces the frequency of painful crisis and might reduce the need for blood transfusions and hospitalizations. Hydroxyurea seems to work by stimulating the production of the fetal hemoglobin, the type of blood found in newborn babies that helps to prevent the formation of sickle cells. Hydroxyurea may increase the risk of infection, and there is some concern that long-term use of this drug may cause problems in later life for people, who take it for many years. So study is still ongoing whilst the drug is in use by sickle cell patients. Hydroxyurea is a kind of like it's like a cancer drug, that strips the immune system. I've forgotten what it's called. You know what cancer patients will take? It strips the immune system, then it makes us susceptible to more infection. So it is a double-edged sword, and study is still ongoing whilst it's in use. And the other treatment is bone marrow or stem cell transplant, also, where they offer the only potential cure for sickle cell. And this is usually reserved for children in very, very severe cases under the age of 16 because of the risk of death. And this is also on the operating theatre, on the operating table. Finding a donor is difficult. It's usually, a sibling, a full sibling, have to be, and it can be painful for the donor as well as the receiver. And there's serious risks associated with it, including death. It's not available on the NHS, and it can cost from anything from above £50,000, to £120,000. Plus, there's costs for aftercare, so it's not cheap, you know. And then you had Valoxita. Now there was a headline last year on the 3rd of March, the 3rd of May, and it actually was on the television. Sickle cell was on the television, and they spoke about thousands of patients with sickle cell disorder are to be offered a new life-changing treatment on the NHS from today, following the approval and rollout of the new drug that could significantly improve their quality of life. Valoxita will be administered in the form of a tablet to be taken once a day for eligible patients and could help to reduce the need for blood transfusions and lead to fewer hospitalizations. It could benefit patients who've had a history of severe reactions to blood or who may not wish to take blood transfusions. So those are the three medications. sickle cell patients. Now, we've been known to be very difficult. When I say known, we're accused of being very difficult patients because we can go into the hospital in screaming pain and nobody's really understanding what our issue is. You know, they say that we have paranoia, we have a chip on our shoulder, or we always throw the black card. Is it because I'm black that you're treating me like this? You know, this is like things that we have to put up with. But I just want to share a study with you, 2023, from Dr. Okoli from King's College Hospital. But let's look at sickle cell anemia first. Ethnic groups affected, predominantly African and Caribbean. Numbers affected in the UK, 17,500 patients. When was this genetic abnormal, you know what I'm trying to say, abnormality identified? 1956, right? 56, 66, 76, 86, 96, 2006, 2016, 2000. So we're talking about 69 years ago. It was identified. Official drugs developed for the disease I just showed you on the page before. So there are 3. The transplantation available in adults. When was that available? 2019. Okay. Let's look at cystic fibrosis. Ethnic groups affected, predominantly Caucasian. Numbers affected in the UK, 10,500 patients opposed to 17,500. When was it identified? 1988. We was identified in 1956. They were 1988. Official drugs developed for the disease, 511. We have 511. When was transplantation available? 1989. So it was identified in 88. A year later, in 89, transplantation was available. Sickle cell, it was identified in 56. 2019, it was made available. So that is why it's so important for our numbers to be counted, because they're not taking any notice of us. You know, so I'll be really throwing the black card. Do I have a chip on my shoulder? Am I really paranoid? You know, if these are the statistics. Okay. So remember I told you about the rollout in May last year, 2024, when the NHS rolls out life-changing treatment for thousands of sickle cell patients, yada, yada, yada. Well, September of last year, Pfizer voluntarily withdrew all batches of Aloxita. Reason, clinical trials and registry studies show that the drug's benefits no longer outweighed the risks. The data indicated an increased number of deaths and crises in patients taking Aloxita. So remember, before it was studied and they were rolling it out, up to 4,000 people in following the approval and rollout of the new drug that could significantly improve the quality of life. 4 months later, the data indicated an increase, you know, it's like, so really, do we have 2? No, I'm 3. No, we have 2. There's only 2 available, 500 to 2, you know. So that is why it is so important that the sickle cell patient, you know, takes personal responsibility to the next level. You know, look after yourself. Take your care into your own hands. Next, I want to ask you to scan our petition. It's what I mentioned before. The sickle cell condition is a multi-organ disorder characterized by episodes of severe pain, and living with it can cause over 100 other serious medical conditions to manifest in a single individual. Heart attack, pneumonia, stroke, brain aneurysm, chest infections, kidney failure, all of these things, individually, all of these conditions can cause death, but may not have been prevalent if the individual did not live with the sickle cell condition. Please help us by signing our petition to have sickle cell listed on our death certificates. Help us to be counted. Help us to be seen. Okay, so I'm going to come into the end, and I just want to say, for many decades, it's been my personal view, you know, that and associated many people of color, right? Just because sickle cell is associated with mainly people of color, this is the main reason why it hasn't received even half the amount of attention as other painful, debilitating, life-changing, life-altering killer diseases. Therefore, it has been left to those that suffer. But why am I advocating for myself? You don't see the person with cystic fibrosis all over the place advocating the things in place for them. The cancer patient has things in place for them. If I say I've got sickle cell, you have to fight. You know, I can't live in conditions like this. I need this. It's this constant fight as an individual. There needs to be policies and things in place for us. So as I said, therefore, it is left for those that suffer and those that are associated to this condition to lead the work within the realms of real peer support, medical research and awareness. It started with a sickle cell warrior, Neville Clare, and still we're fighting, still. Even to this day, many qualified doctors receive no training on this condition during their time spent in medical school, and sadly only associated with sickle cell when they are faced with the patient in full-blown crisis in A&E or in their GP surgery. And because of this human rights travesty, yes, I said it, human rights travesty, I feel it is very important that it is noted and recognized in hospitals, clinics, with general practitioners everywhere, and with research, that the adult sickle cell patient is the expert in the room. Right? He's accustomed to living with his strain, his unique strain of the sickle cell disorder. And my personal hope going forward is that I will witness the change in attitudes and I strive to see a real cure for every person, which means policies in place to assist the complete halt to the manifestation of the sickle cell anemia gene. And before I go, I just want to advise any sickle cell patients or anybody with any kind of health issue on the call to please take self-responsibility to the next level. Ensure you keep yourself hydrated. Take your prescribed medications as directed. Engage in light exercise daily. Keep your home well ventilated. I know we cannot take the cold, but you do need an airflow, because if you're not, you're breathing in the same dead air, and that's causing issue. Avoid foods that cause you an issue. If you eat a biscuit and it gives you a stomachache, your body now has to fight. Your body's in pain. Pain is an indicator that something is wrong, So if you're going to eat foods that's causing you pain, you're making your body fight, and this can cause a sickle cell crisis. So avoid the foods that cause you issue. It's not everything for everybody. Choose something else. Research the natural plant options to assist reduce the prescribed option of medication, and keep up to date with your medical appointments. And when you go to these appointments, be prepared. You have 10 minutes allocated to you. So beforehand, when every day you should have something on you that has your name, your date of birth, and your hospital number on it, saying that you have sickle cell and what type of sickle cell you have. Because if you was to drop down in the street, you need to know, they need to know that you have this. But now when you're going to the doctor, prior to your appointments, add to this paper the names and frequency of all your prescribed medications, supplements, and over-the-counter drugs that you're taking. There's no point you going into the doctor, sitting down now for your 10 minutes, and he says, okay, right, I know your name, I've got that in front of me, what medications are you taking? You say, oh, well, at 10 o'clock, I take the pink one, and then I've got the blue one at 2 o'clock. You're wasting time. You're wasting your time, So have this all ready for the doctor beforehand. Have any symptoms that you're currently experiencing on that piece of paper, when they began, how often, and how frequent they occur, and how severe they are, from 10 being the most unbearable, to 0 or 1 being that you can cope, and that's why you're here, and what do you do that makes these symptoms better or worse? If you have all of this listed, all of this information listed, and hand that to your doctor, whether it's your consultant or GP, whoever you're seeing, they can glance through this, and now that will take them a minute. Now they can look up, you've got 9 minutes to go through the reason why you're there, and not wasting time talking about things that's taking up time, not getting to where they could be sending you for a scan, sending you to a different hospital. They're taking up time talking about the color of your medication, right? So that's what I wanted to say. And finally, what can you do to help us and your support group? Please scan our QR code to become a member of Sickle Cell Cause. We're looking for support wherever we can. So if you are a sickle cell patient and you need support, that's the QR code. Or if you want to support by volunteering or in any way, it's the same QR code. And that's our information there. Your donations to assist our works is gratefully received. And that's it. That's all I have to say. So thank you very much. As I said, my name is Karsheta Penefes, and it was great speaking with you today. Thank you.
Thank you.